안녕하세요. 제가 오늘은 North Carolina에 와서 당뇨에 대해서 미팅이 있었는데 여기 계신 분이 엔도크린이라고 해서 내분비 내과 전문의 선생님인데 제가 예전에 Continuous Glucose Monitoring이라고 해서 24시간 혈당을 재는 기계에 대해서 잠시 이야기한 적이 있었습니다. 그런데 거기에 대해서 제가 별로 그렇게 좋은 이야기를 하지는 않았는데 오늘 여기 내분비 선생님하고 이야기를 하면서 이분만이 약간 다른 퍼스펙티브, 다른 뷰포인트로 24시간 모니터링의 중요성에 대해서 좀 말씀을 하셔서 제가 환자를 볼 때 저도 이제 24시간 모니터링을 하는 분이 몇 명 있기는 하는데요. 이분이 말한 것도 굉장히 중요한 포인트라서 제가 인터뷰를 요청을 해서 오늘 제가 여기서부터는 영어를 할 테니까 양해해 주시고 나중에 서브타이틀을 넣겠습니다. Thank you for doing this interview with me. You know, I talked to you about this continuous monitoring last night, and I really liked your point of how to manage diabetes with using this device. And I only had a few patients on it, and I was thinking a little different things, and then your perspective was very important, so I wanted to mention it. So
thanks for having me. So what we are looking at basically with continuous glucose monitoring is a small sensor or patch that you wear on your arm that measures interstitial glucose. And as opposed to finger stick glucose, which is what we've had for a long period of time. And even though you check your blood sugars a lot, you still miss a lot of what's going on in between those times. So what I found very impressive or meaningful or to patients is we can do there's two different kind of forms of the continuous glucose monitoring. We can do a diagnostic continuous glucose monitor where basically you wear the patch for like 2 weeks and then you come back to see your physician, doctor, and then you take your log of what you're eating and the medicines you're taking and insulin you're taking, and then you can really match it up and see what's going on in the background. It also helps to see which types of foods spike your blood sugar, which types of things, activity, how that affects your overall blood sugar control. So it's a really great tool to use, and you don't have to prick your fingers multiple times a day.
the fact that I really like about your viewpoint was that before I was always believing that if you're a patient who really willing to control this diabetes, you should be willing to poke yourself several times, at least just for 2 weeks. And that was the way I practiced. And if you don't even want to spend 2 weeks doing that, then don't come back to my clinic. Probably should not say that, right? But I try to make my patient get involved, and then freaking their finger is one of the effort that they have to pay. However, that's not easy. I mean, I don't like to put my finger either. Many doctors that I have seen, they use continuous glucose monitoring for more of a therapeutic than diagnostic. So I kind of really like the idea that you jump onto the diagnostic and really find out.
Right.
Because when I do make people to do diabetes diary, when they come back in 2 weeks later, they usually tell me like, oh my God, I had diabetes for 10 years. I never realized how bad I was eating. Now it shows. Right. So that's why I was keep continuing about diet diary and 2 hours postprandial finger checking. However, practically, not everybody can do that, and I have seen many people who didn't do it, and I used to just blaming them like, oh, you are not really strong enough to do this for me, and
It's
and then,
hard.
Yeah, it's hard. So
hard. This makes it a bit easier. I mean, you still have to do the work. You still have to write down what you're eating and logging and things like that, and it really gives you the insight. A lot of times, even you'll check the overnight while you're sleeping, and a lot of things happen with your blood sugars that you don't know about. Could be very low blood sugars, very high blood sugars in the middle of the night, and unless you're going to get up multiple times to check, you're kind of missing that. One of the other usages of the CGM is the personal version, where It does make life a lot easier if you don't have to prick your finger and you have more information when you're dosing insulin or taking medication. So that's another option. But I find the diagnostic really illuminating to patients because you don't really know what's going on.
Right.
And if you could do it for 2 weeks, that's great. I mean, you wear it for 1 week even, and you can really see and target the treatment so that. Do you need more insulin with breakfast? I ate a bowl of cereal. What happens when I eat a bowl of cereal? Whoa,
exactly.
It spikes up. Maybe I should stay away from the cereal.
Trying to teach that insight had been very difficult until continuous glucose monitoring, and that's when I kind of realized, I can make a lot more patients compliant with doing that instead of having them poke four times a day or how many times a day do, and then open time. I mean, a lot of my patients come to my clinic from far away because they watch my YouTube or something, so they are very enthusiastic and they're like, I want to fix this, and I drove 2 hours to see you. So they are very motivated patient who does it, but most of primary doctor's office, these are not typical patients, right? So I think it is very good that you've been using that as a diagnostic tool, and then open my eyes that I can do that for less compliant or less motivated patient.
Yeah, and you can see, better compliance, less pain, and hopefully more insight.
So let me ask you this thing. Just came across my mind. In my YouTube channel, I talk to them about diet and exercise and medicine. If you divide that by percent, how much percent of diet and how much percent of exercise would compound your diabetes management?
75% of diet and exercise. Or even more. Look, at a certain point, the progression of diabetes is that your pancreas is going to poop out, and you need help with either medicines or insulin.
Yeah.
But the way to stave that off is good diet and improve exercise.
Yeah. So look at people, 75% or more is diet and exercise, not the medicine.
Right.
And I usually tell them like 70% diet, 20% exercise, and 10% medicine. But if you cannot do exercise, then 30% medicine and 70% diet is what I usually tell them, in my personal view.
And it's not a punishment if you need medicine or insulin. Sometimes that's just your diabetes. That's the progression of your disease. But a diet is a huge part, and it actually will compound or will impact the amount of medicine that you need. So
we already talked about entire day about what diabetes is about, but I want your word on this, what diabetes is all about.
So diabetes, it's a worldwide epidemic, and it's really combined with metabolic disease. So everybody with diabetes pretty much has metabolic syndrome, okay? And then that puts you at such a greater risk of complications like heart attacks, strokes, kidney problems, nerve problems in your feet, eye problems. So we know, tight blood sugar control or good blood sugar control can prevent a lot of this. Also, we have now more medications that are helping to prevent some of the complications from diabetes. But the most important thing is being identified with diabetes and working on your diet and exercise, and then in association with medicines, and then hopefully you'll live a long, prosperous life.
Yeah, because majority of treatment is still diet and exercise, right? So I think the education to the patient. Education is the most important thing to change lifestyle. I mean, you do have to take medicine, but if you are taking medicine and drinking all these carbonated sodas and a lot of carbohydrate, is not going to happen, right?
I recommend small changes to start.
Right.
Okay, you don't have to do everything and cut everything, but just pick one or two things when you start with your diet. Maybe it's quitting the soda, maybe it's quitting the juice, maybe it's stopping eating cereal, just one small thing, and then you can gradually.
And in order to change that small thing, the key point is having an insight, and this continuous glucose monitoring for a week, 2 weeks, or 1 month will definitely give you an idea and give an insight of doing it. That was a good point, because I was always focused on having patients be more on board, and checking it was only my focus, but I think making them easier to check it.
Right, and what are you going to do about
Right.
What are you going to do about the numbers,
Yeah.
right?
Yeah.
That's the key.
Yeah. And this is not sponsored by continuous glucose monitoring company, and this
Yeah.
meeting was not about those. So we were just talking about diabetes, and this just came out. So just want to have a disclaimer that this is not sponsored by anybody, right? Because if people will be saying, "Oh, Dr. Choi is getting sponsored by some company," no,
No
it's not it,
sponsors,
right?
yes.
Yeah, and we are really trying to help patients to get educated, so better diabetes treatment, right?
Absolutely.
And then probably you can start a YouTube channel to educate your patient too.
This will kick off my YouTube
Right.
career.
Yeah. So I really appreciate you come and do interview with me.
My pleasure. It was great meeting you, and I'm glad we could have these conversations.
Great.
All right.
Thank you.